I'm Rachel Lowe. I'm a director at Physiopedia and helping to run the Physiotherapy Management of Spinal Injuries course. And we're here with Associate Professor Lisa Harvey today, just to ask her, just to meet her, so that all the participants from the course, so that you know who she is and who you're working with through the duration of this course. So hello, Lisa.
Hi, Rachel, and hello to everyone.
So I'm just going to run through a few questions, have a chat to you, Lisa, and just ask you a little bit about your work and things. So perhaps to start with, just you could introduce yourselves to everybody, and we could just perhaps find out a little bit about where you work and where you live and what sort of things you do on a day-to-day basis.
Sure. Well, I'm employed through University of Sydney. I'm currently in an academic position through Sydney Medical School. So I sort of really have three responsibilities. So I do my own research, I supervise postgraduate students, so masters and PhDs, and I also teach on the undergraduate and postgraduate, mainly physiotherapy program.
And is all that work mainly in spinal cord injuries, or do you do other things as well?
Predominantly spinal cord injuries, but more so lately sort of other areas of neurology as well, but primarily in spinal cord injuries, yeah.
Good. And how long have you been working as a physiotherapist, or how long have you been a physio? Or don't you want to say? You're welcome not to say.
Yeah. So first 20 years I worked as a clinician in the Sydney Spinal Injury units, and then the last 10 years I've been working as an academic at Sydney Uni.
Excellent.
But I've always taught on the physiotherapy undergraduate and postgraduate program since sort of about the late 1980s, really.
Wow, excellent. And so when and why did you get involved in spinal injury patients, in treating patients with spinal cord injury? What led you into this field?
Well, from the first year I graduated, I did a rotation through spinals, but I mainly did physio because I wanted to do spinals.
Oh, really? That's really good.
I always wanted to do spinal injuries.
Excellent.
So pretty soon after I graduated, I got a position in the spinal unit, and so one thing led to another after that.
Oh, that's really interesting. Perfect. It's amazing that you knew that before you qualified, and that's why you went into physio. It's really interesting.
Yeah, it's funny. Weird, isn't it? But yeah.
Not weird at all. So what are the particular challenges that physios face when they're working with these kind of patients, do you think?
Challenges. What are the challenges? That's an interesting question. I think actually working as a physio with spinal patients, people don't sort of realise it, but I think it actually requires a real breadth of knowledge, because even though it's a very particular patient group, you actually need your skills in, respiratory, you need your skills in exercise physiology, you need your skills in neurology, you need your skills in pain management. It sort of goes across everything. So I think the challenge would be the breadth of understanding of physiotherapy that you need to manage a person with spinal injuries.
I think that's a really interesting point to make, because often people might think that spinal cord injuries you just fit into the neurology sort of speciality, but yes, you do need knowledge of everything, don't you?
It's actually a very generalist.
Yeah.
Because you need skills across every domain of physiotherapy.
Yeah.
As everyone will realise who's not familiar with spinal cord injuries as they go through the course.
Yes, yeah. And so your teaching as well must cover quite a breadth, all this breadth of all the different sort of clinical areas. And you do a lot of teaching, don't you? You mentioned already that you do teaching in medical school at Sydney, but I understand you do a lot of teaching all over the world in low and middle income countries as well. Can you tell us a little bit about this and how you got involved with this?
It's maybe really the last sort of 10, 15 years I've been increasingly involved, primarily around Asia, because I live in Australia, and Australia's right in the middle of Asia.
Yeah.
So I've been very fortunate to go to a lot of places around Asia and run workshops on physio management of spinal injuries. And it's been a wonderful experience. But how I got involved, it goes back to sort of in the early, 2004 exactly, to be precise. And I was actually working for a US drug company, and as a consultant, and my job was to go and train all these different clinical sites around Asia that were involved in this big drug trial, and that's actually where it all started from. And then one thing leads to another, and yeah.
And so that sort of gave you the contacts to go back and do the spinal cord injury management teaching.
Yeah, I suppose it gave contacts, gave me the interest, gave me an insight to what's going on in other countries. Yeah, and then I got very involved in ISCOS, the International Spinal Cord Society, and I was involved in the education committee, and, sort of one thing leads to another.
Yeah, I think it's amazing that you do so much travelling and put so much effort into your teaching, and that's reflected as well in you doing this course with us, which is great that we're able to make this course available to everybody. So what are sort of the important factors or things that you think about this course? Why do you think it's so important, and why is it so useful to people to complete this course?
Well, my motivation to do it, well, number one, you asked me to do it.
Yeah, because we might like making courses free and open and available.
And why did I take up the challenge? Because I really believe in the philosophy of free education, and I think education is absolutely everything. If we're serious about wanting to improve the lives of people with spinal cord injuries, especially in some of these countries where the physio profession is relatively new, then I think education is the key. And, I think this is a good way of rolling out education to a lot of people.
Yeah, and we're really pleased that you've been agreed to come and work with us on this, and we're really pleased to be able to collaborate with you because we hope that everyone will find this free course really useful and gain knowledge from it so that they can take that forward into their clinical practice.
No problem. Thank you. But I suppose one of the things I should say is the course is basically, it's structured around those eLearn modules, so eLearn SCI, and the important point to make, and I want to give credit to where credit is due, is that was driven by ISCOS, and a lot of physios from lots of different countries have contributed to that. So the content people will be moving through, I'd like them to appreciate that this has been put together by a lot of different physios everywhere, and so credit to and thanks to all of them.
Yeah, so a lot of knowledge coming from a lot of different places and a lot of effort from a lot of different people, and we're all thankful to them for putting the effort in to make all of this available to us in the forms that it's been made available. So I guess just one last thing to ask you, any advice or messages for the course participants as they go through this course with us all?
If you're going to get the most out of it, you've got to embrace the experience and you've got to actively participate. And I know all of us tend to sort of shy off a little bit from engaging in online conversations, but if you want to get the most out of it, then I would really encourage you to engage mainly in the Facebook conversation. Obviously do all the things that we're telling you to do and try and, really do it, not just sort of superficially skim over the top, but really try and get involved, and then you'll get the most out of it.
Great. Well, we're really looking forward to the course, which starts in about 3 weeks' time now, I think. So we're looking forward to being involved. We're looking forward to working with you and all the course participants. And so thank you for this little message today to everybody, and we look forward to working with you through the course.
No worries. I really look forward to working with everyone. And so it's a very exciting opportunity, and thanks to Rachel and Tony and Physiopedia and ISCOS and everyone.
Yeah.
So let's hopefully make it a really positive thing for all of us.
Good. Okay. Thank you, Lisa.
Thanks.